So we're very glad to have you here. We've done a couple of Zooms over the last couple of months, but things keep changing, as you know. And so this is our one for August. And you know who we are, and that we are here in Central America. And we have put this disclaimer at the bottom so that if anybody objects to any questions and answers at the end, they know that that's individuals speaking on their own. While COVID-19 consumes the news and people's thoughts, the Center for Development in Central America is dealing with the virus while trying to serve Nicaraguans and also protect our staff, our patients, and others, as well as continuing to work in the areas that our organization has chosen to focus on: sustainable agriculture, sustainable economic development, healthcare, and education. With COVID, it is easy to be overwhelmed with this one health issue. But as our project's leaders and the co-ops that we work with have told us, COVID will be with us for a long time. So we have to move from pandemic to progress. It is time to protect everyone the best we can and get on with the work. Who are we? We're a small organization. We, the Center for Development in Central America, have been in Nicaragua for over 26 years now as the Nicaraguan project of the U.S. 501c3 nonprofit, the Jubilee House Community, Inc., who have been working with the poor in the U.S. and here in Nicaragua for more than 40 years. So how did we respond to the pandemic when it began to show up in Nicaragua? Paying close attention in the spring, we jumped on adding protective policies at the clinic, while opting to suspend our educational activities at Casa Ben Linder until they could be held in safety. Then, as confirmed cases in Nicaragua spiked, we closed our clinic for June. We sent staff home with their full pay, while those of us who could work from home continued working, doing financial reports and paying bills and payroll online, while making phone calls and attending conference calls, holding office staff meetings outside with masks and social distancing. And even though we're no longer able to host international volunteers because of COVID-19 travel restrictions, and with few guests staying at Casa Ben Linder, we have continued educating people around the world to the burdens Nicaraguans have to carry due to poverty, using Zoom presentations like this one, blogs that are usually published twice a week, social media posts almost daily, and newsletters like the one that will be published online as well as printed in September. Returning to work the 1st of July, we have worked hard to move from pandemic to progress. We've put stringent policies in place to protect the staff. All staff must wash their hands at stations we have set up in front of all our buildings' entryways. And we all have to wear masks. Most are cloth and sewn to our own specifications. People coming in to meet our staff have to meet outside in an area that we have set up, nicknamed the Pandemic Pavilion. And at the health clinic, the policies are even more stringent. Not only do our healthcare providers have to wear masks, but they also have to wear face shields and gowns as well as hair coverings. The patients are checked in outside under an awning before seeing one of our 3 doctors. We are being safe, but we must move from pandemic to progress. Outfitting everyone has been expensive and has been a serious hit to our budget. But here's what the Nueva Vida Clinic has been and is providing and how you can help. A pediatrician who does a great deal of asthma treatment, especially with children. A general physician who focuses on our patients with chronic conditions, and our radiologist who also sees patients as well as doing ultrasounds. We are seeing pregnant women again, though our support group has not yet begun to meet. Rooms are disinfected after every patient, while providers change out their washable PPEs. Patients with COVID symptoms are sent to a government-run clinic, the only place that tests are available. It sounds a little excessive, doesn't it? But not when 3 of our Nicaraguan co-workers have recovered from confirmed cases of COVID out of our total of 23, and 1 has died. We lost Yesenia Castillo, our health promoter, to COVID just recently. Her death has left a hole in our hearts. She had pre-existing conditions and was hospitalized. Her body went straight from the hospital to the grave, with few family members able to attend at the graveside. Many of our staff, as well as patients, do have pre-existing conditions, which means the clinic staff must be garbed, looking like they are ready for aliens. And it leaves our construction fumigating staff grumpy because they also have to wear masks. Those of us in our late 60s and 70s are self-isolating and working from home, like me, presenting this from home with Becca in the office, and being confined for 5 months now leaves us fairly grouchy as well. Mike and Becca are in contact with CoProXNIC, the Organic Agricultural Cooperative, by phone or meeting outside with masks, texting and talking on the phone to buyers, shippers, etc., all the time trying to get them better financing while dealing with the ins and outs of management, especially when English is needed. Agriculture goes on despite the pandemic. The first crop of organic sesame in this rainy season has been good. The sesame plant is running with strict health protocols in place for the safety of the workers and the product. CoProXNIC and we are trying to set up an organic peanut processing plant for this year's crop, which takes lots of effort and is more frustrating because of having to work from home. But we are progressing, aiding the cooperative through the Vita Fund, helping to keep value in Nicaragua, which is good for the growers, the buyers, and these economic efforts also provide jobs. Coffee is growing well, we are told. Farmer Shares, a CDCA project, is selling the organic coffee grown at a small coffee cooperative located on the top of a remote Nicaraguan mountain. The coffee is tasty and helps this cooperative to stay afloat. So if you drink coffee, this is one way you can help. Buy from Farmer Shares. Meanwhile, we as a society have recognized that we will have to live with the COVID virus for the foreseeable future. And so with help from a donated bleach making system using water, salt, and electricity, our disinfecting costs are lower. The clinic staff now also packages up monthly chronic care medicines for delivery to all our patients with pre-existing conditions. Family members come outside and receive the medicines for their loved ones, trying to protect those at higher risk. Our lab sees patients in the morning and reports the results to the doctors for the best targeted treatments. Our dental clinic is doing limited dental care. Dental clinic staff are at extremely high risk. Our therapist keeps social distance from her clients. She sees adults and children and has activities for the children. We're offering non-essential services on specific days and in areas only open to healthy patients in order to decrease virus transmission, for services such as family planning, including birth control implants, PAPs to test for cervical cancer, ultrasounds, and EKGs, as well as eye vision tests and providing corrective lenses. The education training room has been getting finished with our construction team maintaining social distancing, and just last month held 2 training sessions for our health promoters on identifying dental emergencies. We are exploring ways to continue at least educating our 30 lay health promoters, bringing Amir on staff to continue Yesenia's invaluable work. Progress also means that the space, which now meets national required radiology specs, is finally ready, and the donated used X-ray equipment can now be cleaned and tested. And with other help, the clinic is moving forward toward implementing a digital medical record-keeping system that can be accessed offline during remote community visits. Also, moving us away from so much enormous paper use. The initial 6-month costs for startup technical design support and training have been donated. Exciting progress, and we are scrounging for funding to purchase the needed tablets and phones to fully implement the system in all areas of clinic service. Though the CDCA closed for a month, Nicaragua as a nation has not closed except to restrict international air travel, but has implemented an enormous COVID-19 education campaign. Social distancing and masks are required in government buildings and businesses. Market vendors wear masks mostly, but many of the shoppers still do not. Public schools are trying to be flexible, offering classes to 1 grade a day to avoid crowding the students. Students are required to wear masks and hand washing stations are set up. Virtual classes are also being offered through TV channels, the radio, and online. One of the more impressive things that the government succeeded in just this past month was providing several days of virtual concerts on television and radio for the 19th of July holiday, which is usually a huge gathering. Last year, over 600,000 people came to celebrate the triumph of the revolution. But instead, this year, they provided fireworks the night of the 19th that people could see from their cars in Plaza de la Fe and widely encouraged celebrating from home. Then the president did his version of the State of the Union address to the nation via television and radio, with only his cabinet on the platform, social distancing and all wearing masks, and with only the Sandinista youth in attendance, again with masks and social distancing. The president addressed Nicaragua about the health of the nation in the context of Nicaragua having fewer confirmed COVID-19 cases per capita than all of its Central American neighbors, and maintaining a controlled infection rate since May. He described as well the new hospitals, the cancer treatment centers, the ventilators, the new public clinics, the centers mothers at risk can go and stay until they give birth, and all the long-term investments that mean progress in healthcare. Life goes on in this time of pandemic. The Nicaraguan government is doing its best, and so is the CDCA. But as many of you know, we cannot do this alone. To truly progress in our work with the poor, as has always been true, we continue to need your help. Please help. You can help progress continue. Together we can bring hope in the midst of pandemic. Our web address is at the bottom of the screen, and snapping the scan code on your phone will take you to our donation page. We need you. Please help. And thank you so much for joining us today.
Thank you, Sarah.
Thanks, everybody. For those of you who are just joining us, if you would please sign in with your full name and email address in the chat, we can send you a link to the recording of the session. And anyone who has questions now, you should feel free to unmute yourself and ask those questions, or raise your virtual hand, or send the question in the chat.
Go ahead, Marianne. You look like you were going to ask a question.
Oh, not really a question. I just want to say thank you very much for sending out this Zoom. I really wondered what was going on, you know, with your program. And I think it's very, very helpful to communicate in this way. So I'll carry this on to our Quaker meeting. Thank you.
Thank you for taking time. I know you all are busy, even though you're home.
Anyone else have any other questions or comments about Nicaragua or about our work?
Yeah, how many babies are born under your program every year?
I think it was around 80 babies a year. So at any given moment, we tend to have about 40 women in that group. And most of the women age between 14 and 19 years old. They go from, we bring them in when they're pregnant and go through prenatal care. Usually there's a support group, and right now our support group is not active. We're just bringing them in for their monthly checkups with the doctor. They're doing ultrasounds as well now again. And once they've had their baby, they join our lactation group, our breastfeeding group, which goes through the baby's first year. And then they have the option of joining our mothers and toddlers group, which goes from 1 year to 5 years. And that includes well child checks, as well as a monthly support group. It does a lot more dealing with nutrition and discipline and other issues that are coming up later on as the children move from babyhood to toddlerhood and into childhood.
We thought originally it would just be a new moms group that would phase out after a year, but they liked it so much they asked for us to extend it, please, into an older years group.
New Mothers Group has been very effective in getting new health promoters in. A lot of the women who start off as new moms learning about going through pregnancy and childbirth wind up getting so interested in public health that they become our health promoters and help other folks in the community.
Thank you. I have a question. After hearing the fine work that's being done, and the question is there a two-way street of communication going on between churches here in the States and in Nicaragua, such that they understand and are being made aware that there is such poverty and lack of health care and need for food and family support among many communities in the U.S. Is there that kind of communication going back and forth? Thank you.
Are you talking about church to church, or are you talking about society in general to society in general?
Oh, either and both.
One of the things I think that is true is that Nicaraguans are very astute internationally. They pay attention. They are well aware, for example, of what's happening with COVID-19 in the States. They are aware of the Black Lives Matter movement. They are aware of the unrest and the poverty and extreme. I think they find it impossible to believe that people really are homeless and sleep on the curb, because here people are taken in by somebody, by a family member, by somebody. So there are very few people that are truly out on the street, and they think that's wrong, and why should that be true? Why doesn't somebody take them in? But they do understand that there are these economic issues in the States because they watch the news and they pay attention. So anybody else want to comment more to that? And so I think there is a two-way street, that the folks here, when people in the U.S. help, either by sending donations or by coming as volunteers, folks here appreciate the sacrifice that takes on the part of folks in the U.S. They understand that when people come for a week, they have taken up a week of their lives, and they've paid airfare, and that doesn't just come, just, oh, here, let me just throw that out the door because that's easy for me to do. They understand that that is a real gift, and they are always very grateful and very appreciative. So I know that they appreciate the folks that are directly in communication with the work here, and they watch what's going on internationally. And things like this Zoom are our attempt to then get the communication going the other way as well.
Are there Zoom meetings going back and forth? In other words, are some of the participants in Nicaragua on this Zoom meeting, for example?
Ligia she's one of our dental co-workers. Let's see, is anybody else on right this minute? I don't think so. Some of the others of us of the international English speaking group are on, but Ligia is working with us on the HICMA medical digital system that we're trying to put in place. And so she was very excited to see what we were saying today to everybody.
Thank you.
I can see that Bill has texted his question to us. Thank you for that, Bill. The question is, what's the general cooperation with other NGOs, and are most of your clients from Ciudad Sandino or other parts of Managua? I'll answer the second part first. At the clinic, we see patients from Ciudad Sandino. They have to be residents of Ciudad Sandino to be seen at our clinic. When we first started the clinic 22 years ago, 21 years ago, we did not make that distinction, and we wound up getting people from all over Nicaragua who were coming to our clinic. So we realized quickly we weren't going to be able to deal with that, and so folks have to be from Ciudad Sandino, which has about 180,000 residents in it. So that's plenty of patients for us, and from in our other areas of work, we do work in other places, especially in agriculture. We work around the country in Western Nicaragua. So not just the Department of Managua, but also the departments of León and Chinandega. And in terms of cooperation with other NGOs, we do a fair amount of cooperation with other organizations. We cooperate with the Nicaraguan government, and whenever possible, we love cooperating with other NGOs, either here in Nicaragua or elsewhere. So next month and the following month, we're expecting shipments of donations actually from an organization called Peaceworks in New Jersey and one called Quest for Peace in Connecticut. So there's lots of ways that we connect with those groups, and then we help them get their donations to other organizations here in Nicaragua.
And then also a group called Orphan Network, which is out of the U.S. but has organizations here. They provide assistance to children who show up at feeding centers as sort of their own meal of the day, their only guaranteed food of the day. And their assistance has been to provide additional support for our dental program, so that our dentists try to get those kids in from, I think it's like 13 or something like that, different feeding centers, try to get them in every 6 months for cleaning and sealing. And we couldn't do that. The staff didn't have the time. So we brought on more staff to help do that. And Lihia is one of the ones who goes out into the schools and does education in the schools. And that's a nonprofit working here in Nicaragua in a wide number of feeding centers in various little communities around. So those kinds of things. Trish, nod your head. Did that answer Bill's question? Okay, good. Hello in Colombia. There you go.
Could I ask one question relative to an idea or a question that comes to my mind? What level of support is the U.S. government providing to this type of work?
The U.S. government?
Yes, yeah.
None. Zero. We get zero from the U.S. government.
They're not offering any support at all to Nicaragua,
if I may weigh in on that one, currently there are kind of two levels of aid organizations in Nicaragua, and probably in other places as well, but we know Nicaragua, so we can speak more authoritatively about that. And there are those that are on the ground relating closely and more directly with communities, and getting what I would say is the vast majority of the work done. And then there are those that are funded on an ongoing basis by, like, USAID, and having had some pretty intimate involvement with that process. That's really all about getting your quarterly reports in on time so that reports can be made to Washington, and updating photos so that brochures can be printed and reports can be written, and not really so much about actually getting anything done on the ground. And I think that's kind of where we are right now vis-a-vis aid that is coming in into Nicaragua. And then we've been very disturbed. It just came out last week that there was a memo leaked from the U.S. Embassy here that basically lays out a strategy to disrupt next year's elections in Nicaragua and bring about a change in government with or without support of the Nicaraguan people that's more in line with the policies and goals of the U.S. administration. And that's that has us very concerned.
Thank you for sharing that. Concern is multiplied by many people who have heard that.
If you want more information on that particular last point, Kathleen just wrote about it in our last 2 blogs. So if you go to our blog spot, you can find more information and how to get to that information directly yourself. Becca, could you maybe put our blog address in the chat?
Yes, I'm doing that right now.
Thank you. Are there any, if for lack of a better term, missionaries from Nicaraguan communities coming to the U.S. on any kind of like an exchange type program?
Not that I know of. The only folks that I know of are people who are Nicaraguan married to U.S. missionaries to Nicaragua.
I'm sorry, what
I
type of
only know
mission?
of, yeah, Nicaraguans who are married to missionaries from the U.S. to Nicaragua. So,
Oh, okay.
yeah.
At the moment, there's no flights available from Nicaragua to the United States. The airport has been closed for months. So even if somebody wanted to do that, they couldn't do that right now.
Is that different than it had been before COVID?
Oh yeah.
Yeah.
Before COVID, there were daily flights by a multiple variety of international airlines. But the current restriction here is to keep people from coming in, bringing the virus to Nicaragua.
Yeah.
And so
Right.
that is what's going on right now. And
Right.
the airport is trying to figure out what it can and cannot. They've had like 1 flight a week or something like that. Don't quote me on that. Of allowing Nicaraguans to come home, to let them get home who want to come home. But folks from here don't want to come to the U.S. because it's scary where you all are, you know?
We've heard that flights, Spirit Airlines will resume daily flights to Nicaragua starting on the 17th. That's subject to change. But Nicaragua is now requiring a negative COVID test for anyone who's not Nicaraguan national who's coming into the country. And as usual, they will be doing, before the flights stopped, they were also doing about a 15-minute interview with each person coming in with healthcare workers to get all their, symptom history and where they're going, asking their phone number multiple times. And then they were following up by calling every other day to check on people during a 2-week period to try to make sure they were okay and then to be able to do contact tracing.
That is a wise protocol.
I don't know if you know, I saw the graph as I was talking that went by, but it's a 90% recovery rate currently from the confirmed COVID cases. Now, we are quite sure that the COVID cases are underestimated just like they are everywhere because, not everybody gets tested and it gets put down as pneumonia when it really, was COVID oriented or whatever. So we're quite sure that that's that the number of cases is an understatement. However, they are doing so much better than their neighbors. And out of the ones that are confirmed COVID cases, they've had a 90% recovery. And for the last 4 weeks, there have been a steady decline of number of active cases and number of deaths. And so they're trying really hard to hang on to the progress and hang on to the concern. Nobody's going, oh, it's gone away, we can quit now. Nobody's doing that.
Well, maybe they could send some consultants to the U.S.
That is right now, every time we talk about and every day, you know, all conversations have to do with this pandemic. Everyone says, oh yeah, we're so worried about the United States. We're so concerned about everyone in the US. If you look at the graph, you can see that Nicaragua, when we got community spread in May, then we had a spike, and it went down slightly from the spike and stayed very steady for all of June and July, and now it's starting to go down. So we haven't seen any moment when things were out of control here. We've never had more active cases than we have respirators in the country. And we're a small enough country that we can count those. I think we've got something like 550 respirators, and we've never had that many active cases, let alone, you know, people who are hospitalized in intensive care. So like Sarah said, it is possible that we know there's more cases than this out there, but it's been under control. And so we feel very good. And right now, I would say very different from the US, the feeling here is that we're starting to recover. Kids are starting to go back to school, even if it's just one day a week or partially. People are starting to go out a little bit more. We're looking at the airplanes coming back in. So it feels very different from what we're hearing from you folks in the States in terms of where you are in the pandemic.
Can you see my screen?
Yes, thank you.
Okay, I put that back up so you could see the numbers at the bottom. The top blue line is the total cases overall. Now you have to know that Nicaragua has a population of close to 7 million people,
Okay.
and that's the total cases overall. Then the green underneath it is the total recovered, and then down at the bottom are the active cases slowly going down, and the weekly new cases slowly going down, and the deaths staying at the very bottom.
Well, after you have made this available to the White House, what kind of feedback have you received? Thank you for your work.
Thank you. It's been interesting because this week, as Russia has announced the vaccine, that they have a vaccine, the response we're hearing from the US, which is kind of, oh, well, that hasn't been tested and it's never going to work. And that's, you know, they hacked into, you know, into other companies to get that, is very different from what we hear here. In Nicaragua, just about 2 years ago, Russia actually built a vaccine laboratory to produce vaccines here in Nicaragua, and has been producing flu and pneumonia vaccines, among other things, which is how we and all of our staff were vaccinated against flu with those vaccines this year. We've heard in the news here that Nicaragua will be making, possibly even starting this fall, making the COVID-19 vaccine that Russia is developing. And people here are super excited about that and about the possibility that Nicaragua might be at the, you know, at the head of the line of countries to get some of this vaccine, which has been produced in a public lab in Russia, so is not being produced by a large pharmaceutical company that will be looking for big profits. And the response here is so different from the response we're hearing in the States. There's a lot to be learned yet about this, but it's been interesting for us to watch that.
Mm-hmm.
And the track record on that is that this year, it was just this year, wasn't it, Becca, that healthcare workers went all over the country, including some places by mule horses, to do 4.5 million. Isn't that right?
It was 2 million vaccines.
2 million vaccinations just this year of the flu vaccine, trying to get it out everywhere. Oh, the 4.5 million was the distribution of COVID educational information.
Right.
So in a country of not quite 7 million, they distributed 4.5 million leaflets, you know, flyers of this is COVID and wash your hands and social distance and wear masks and all that, all over the country.
The vaccination campaign happens annually, actually. That happens every year, and that's a door-to-door vaccine campaign. So I've tried on numbers of occasions to imagine where I grew up in North Idaho, if healthcare workers with a cooler came to the door and said, let me vaccinate your children, I imagine those workers would probably be shot. But here in Nicaragua, we've gone and gotten our vaccine cards and gone, who's up for a vaccine? Oh, look, we need the tetanus booster, and been very pleased to have them at our door. We don't even have to go in, and it's free of charge. So that's actually a campaign that they do annually here. And they vaccinate against a number of different diseases. They bring around all your basic vaccines, as well as like tetanus boosters and flu and pneumonia shots. So there was more than 2 million people that were vaccinated against a number of illnesses this year in that campaign. And it's a massive effort of door-to-door vaccination.
Have a lot to learn.
Yes.
Thank you.
Not that we don't know it, it's just we refuse to do anything.
Thank you, doña Sara y doña Rebeca, por esta conversación. Pues le agradecemos a todos los participantes y los esperamos. Dios permita pues que nos apoyen en todos estos proyectos que seguimos y pues aquí estamos para servir.
Gracias, Ligia. Gracias por estar con nosotros.
Yeah. Okay.
So
Thank
that
you.
was Ligia, our dental hygienist, thanking you for being here and for your support of the project, and saying from our perspective here, her perspective here on the ground, we're always ready to serve. So thank you.
Yeah. Thank you.
Thank you.
Alexio?
Shall I tell him my 2-dog joke?
Yeah.
Yeah, and while you're telling your joke of the day, Kathy has a joke every day for Kathleen's mom, who is 90, and
Oh.
she's here with us. And every day Kathy comes around with the joke of the day. So this is this.
2 dogs were commenting on the current state of affairs, and one dog said to the other, "Why are all the human beings wearing muzzles?" And the second dog said, "Because they haven't learned to sit and stay."
Oh, jeez.
Be safe, take care, and thank you so much for joining us and being interested in this work.
Thank you, and you take care. Be well.
Thank you. Thank you.